Elizabeth Neumann used to work for the Department of Homeland Security. She's now a contributor with us here at ABC News. You know, you have tracked these types of threats in our country from a much higher level when you worked within the White House, Elizabeth. And we've been talking about mass shootings, yet another one, this time in Nashville. But a unique element to this, the shooter, a 28-year-old woman. As you've been following this story, the details of this story, what are you asking? What are you thinking about?
Honestly, the first thought is how horrific it is that we've had another shooting at an elementary school. Much like you, my children are at the age that they could be in a school like this. So it's just terrifying, and we need to be able to do better. From a security perspective, I find it very, I don't have a recollection of another private Christian school being the location of a mass shooting. I might be wrong on that, but it is certainly very rare. And I think this is going to shake the private school community. I'm fairly familiar with the private Christian school community in lots of different locations across the country. I know that they have invested in protective measures. Most schools, even if they're small, do some form of active shooter drills. They train their teachers. They have good relationships with law enforcement. But there is a bit of maybe complacency because it's really hard to envision that it's going to happen in this school, in our school. So I do think that this is going to shake the private Christian school community to recognize, like, you need to be on top of your game every day. You just don't know where the threat's going to come from. And then, you know, what Brad was saying is absolutely right. We've spent 20 years really investing in protective measures, and that's super important, but it's just baseline security. We have got to get to the preventative stage. We have an epidemic of violence in our country. While, yes, it's very rare to see a female active shooter, I think we're going to see more because the epidemic is spreading. We have a crisis of despair in this country. We have a crisis of dignity in this country, and that has a radicalizing effect that creates permission structures for people to get to this place where they think violence really is the only answer. And we obviously don't know the specifics about this particular woman and her nexus to this school and what her grievance might be or what her motive might be. But it is a epidemic across our country that we have people that somehow get to that place that violence is the solution. And we have got to be intervening way before they're talking about guns, way earlier in the cycle of radicalization to help people when they're vulnerable and when they're in that radicalizing process. And we have research, we have data science that helps us understand the steps that people take to get to that place where violence is something that they think is a possible solution to their problems. So we have this rich data now, but we're not acting on it. We're not investing in the protective or the preventative measures that we need to be. I've been talking about this for 3 or 4 years since I was at DHS in the previous administration. We have got to rapidly scale the capabilities in this country to be able to do that intervention so that we can reduce the number of people that are able to carry out mass attacks. I don't think prevention is a silver bullet. We're always going to miss things, but we're missing way too much right now. We can reduce drastically the number of mass attacks. I think Pierre was saying we're up to 128 this year, mass shootings. It's ridiculous. We are the most... Go ahead. It's just so stunning. It's so stunning. Our country is so great, and this is where we are.
But I'd like to know. I'd like to know what was the research that you did when you took all these examples of mass attacks, and you're saying right now we know what we can do as a country. What is it that we're not doing, Elizabeth?
So Brad referred to some of this. We know the signs and indicators of somebody that is not doing well. Now, that doesn't mean that they're going to go commit an act of violence, but we can do a better job of equipping our community, especially people that are more engaged in those frontline people that are engaged with the community. So your teachers, your coaches, ministry leaders, youth leaders, and anybody in the social services realm. We need to educate them on the signs and indicators of somebody that needs additional intervention because they are in that process of radicalizing to violence. The goal is not to police people's thought. The goal is to say, like, something's going on in this person's life. We know that mass attackers tend to have had some sort of crisis in their life in the last 1 to 2 years. We know that most mass attackers are struggling with a sense of significance. They may have had a recent humiliation, a recent rejection that often is in the background behind why they're more open to this idea of an ideology that promotes violence. And I don't just mean like a terroristic ideology, but just this idea that can be set in that the answer to my problems is to go cause mass violence. And often it's understood that they're going to end their lives in the process, but we've got to help people well before they're at that place of utter despair that they think violence is the solution. So when I was at DHS, we were talking about equipping and training that frontline, the people that are engaging with youth in particular, but also other parts of the population, equipping parents with basic knowledge of what to look for, signs and indicators that somebody with their child or their child's friend might be in trouble. So one part is equipping people with that knowledge of what those signs and indicators are. The other part is we've got to rapidly scale up our behavioral health community, mental health community. We need the front line of prevention really is not law enforcement, though there is a role and a place for law enforcement. But we desperately need more behavioral health and mental health professionals who are equipped to know how to help people that are in this radicalizing process. And just in general, we have a dearth of mental health support in this country. So even if you're not radicalizing and you just are having a rough time in life and you want to find a good counselor, it's sometimes hard to get an appointment. So it's not just the violence that is why we need more mental health professionals. We just have a dearth in our country. So we need some sort of plan to invest in that community and rapidly scale the capabilities of mental and behavioral health professionals, as well as the social services community. And then we need to create a safe way for people to report. And I don't mean report to the police, but if you see your son struggling and you're concerned because they've talked about purchasing guns, where can you call to get help? And some of the impediments for what we have seen in mass attackers, usually somebody knows that something was wrong. There's a bystander that knew that that something just wasn't right. In some cases, those bystanders report, but the only place they have to report right now is the police. And the police then might do a knock and talk, they might do a preliminary inquiry, but there's been no law broken, so they can't do anything. I mean, this is what we saw happen in Parkland, this is what we saw happen in El Paso. It is a frequent occurrence where somebody knows something's off and they ask for help, and then the system that's set up can't help them because we need this alternative system. So we need a way for the bystander, usually the bystander is somebody that loves that person and wants them to choose a better path, wants to get them help. We need to create that referral system so that they can ask for help and get help for their loved one before they choose a much more devastating path of violence.
Elizabeth, you have made such a good point, and I think we can say this as journalists, you as someone who worked in the Department of Homeland Security, we can say this as parents, when we have personally experienced something like this, there's always a warning sign, always. Every time we have covered one of these mass shootings, whether it was a problem at school, whether it was a counselor that didn't say something in some way, shape, or form when it was needed to be said. A problem with a classmate, things on social media. Every time we dive into a shooting like this, we see that there were warning signs. Elizabeth, stay with me. We're starting to get word now from the White House that the President of the United States will be speaking shortly on this. We do know that the First Lady, Jill Biden, did make a comment that she is truly without words, that our children deserve better. White House Press Secretary Karine Jean-Pierre also addressing this at the White House briefing. Let's go ahead and take a listen. We'll continue our conversation as you are watching breaking news here on ABC News Live.
The president has been briefed on the situation, and our team is in contact with DOJ and local officials about what is known so far. We want to express the president's appreciation for the first responders and prayers for all the families affected by this shooting. While we don't know yet all the details in this latest tragic shooting, we know that too often our schools and communities are being devastated by gun violence. Schools should be safe spaces for our kids to grow and learn, and for our educators to teach.
Karine Jean-Pierre there at the White House during that briefing, talking about the President of the United States has been briefed on this shooting. If you are just tuning in, 7 people now reported dead, including that shooter at the Covenant School in Nashville, Tennessee, a small private Christian school. 209 kids, 40 to 50 staff on a daily basis. The church connected to the school there. The shooter, a 28-year-old Nashville woman. She entered from the side of that school, started opening fire on the first floor, moved her way up to the second floor, gunshots ringing out. After that 911 call was made, there were local Nashville units in the area. They responded immediately without hesitation, entered the school, worked their way up to the second floor where they heard those gunshots. 2 officers engaged the shooter, that 28-year-old female shooter, now dead. We still don't know a name, background, a why, were there warning signs, any type of leads to why she would do this. Investigation that investigation underway right now as we continue to get as many details as we can. 14 minutes it took for that shooter to enter that school, police to respond, engage the shooter, kill that shooter, and the rest of those students, hand by hand, with their teachers, with faculty, led out of that school once it was secured. You'll see right here, brought into school buses, those school buses moving to a safe location not far from the school where parents and loved ones could come pick up those children that survived. This school apparently had gone through active shooting training. That came from a young man who called in. His mom worked at that school. He reported that possibly that shooter, that female shooter, 28 years old, armed with 2 assault rifles and a handgun, blew off a side lock to enter that school, which indeed would show intent that she wanted to make entry and harm to those children. We cannot confirm that. That's just coming from a young man whose mom works there at the school, had been working at the front desk, had been head of admissions there for 20 years. Elizabeth Neumann used to work at Department of Homeland Security. She's now a contributor with us here at ABC News. When you were in the White House, when Homeland Security was your mission, Elizabeth, you assessed these mass shootings. You put together plans for preventive actions as a country. You know, it's not just access to these weapons, as you brought up. It's behavioral health, and it's speaking up when you see that something isn't right. And Elizabeth, you and I both know, covering these shootings, when you learn more about the mass shooter, there was always something that would have alerted somebody, but many a times no one reaches out. No one gets that person the help that they need. Maybe they've tried to get that person the help that they need, but haven't been able to because of the bureaucracy, as we know, within our mental health system. there's just so many factors to talk about, both access to guns and behavioral health, when we continue to watch these mass shootings happen year after year, multiple times every year, Elizabeth.
That's right. And it's, in some ways, coming out of Republican circles, I've avoided the gun control conversation because it just doesn't seem to ever go anywhere. Most of the law enforcement professionals that I worked with were very blunt, and by the way, most people in law enforcement tend to come from that conservative perspective, but they were very blunt that guns are critical to the problem that we have. So if we could reduce the access, if we could do a better job of making sure that they are only going to the people they need, then yes, we would reduce the problem in our country. But that seems insurmountable. We can't seem to get anything done on that, and that's why I've been focusing more on mental health and prevention, because that is something we can't seem to agree on.